What can you see? Can you tell me Khair now?
You are in live now, yeah? Assalamu alaikum, can you hear me?
Yes.
Yes. Did you see my screen or not?
No, not yet.
Okay.
السلام عليكم ورحمة الله وبركاته. بسم الله والصلاة والسلام على رسول الله سيدنا محمد وعلى آله وصحبه أجمعين. أما بعد. Dear brothers and sisters, today we are having here with us Dr. Awal Khair, Muhammad Saeed Hussein, and Dr. Khalid Bashir. I would like to thank them for accepting our invitation and being with us today to benefit the brothers and sisters in UK and outside UK as well. So today we will be talking, inshallah, the doctors, they will be delivering, inshallah, a lecture and Q&A as well. This lecture is going to be ABCDE, simple approach to your health. So I would like to thank the Dr. Awal Khair and Dr. Khalid, and we will start, inshallah, with Dr. Awal Khair.
Thank you very much for the invitation and for the viewers. I'm with you, Dr. Al-Khair Muhammad Saeed Hussein. I am a consultant in stroke medicine as well as general medicine and geriatric medicine. I'm here with the company of my colleague, Dr. Khalid Bashir, which I will let him speak later on himself. We are here to give you some journey and some talk on a simple approach of how you can protect your health. And we call it simple ABCDE. It's guided by the different organizations, as you can see, which I'll show you in my, I'd like to share with you my slides so that we can go through it. And this is part one of my our session, and hopefully we'll have more sessions as we go along in the future. Just want to confirm that you can see my slides. Can you see my slides? Abu Yasser?
No, not yet, not yet.
Okay.
Okay. Let me try again. Screen. Share. How about now? Let me try again. I think the sharing screen is not an easy task. Hopefully you can see me now. You can see the shared slides now?
No, not yet.
No.
Now we
Okay.
can see.
Yes, we can see, yeah?
Yeah.
Excellent. So these are some key points that we've gathered from, as you can see, from the National Health Service in the UK, NHS we call it, from the World Hypertension League, International Society of Hypertension, and I'm a member of the British and Irish Hypertension Society, which are the specialist team looking after hypertension or high blood pressure. So we'll go through this journey, and as you can see, the ABCDEs that we would like to talk about are this in general. So today we're going to be talking about not A, it will be B. But at the end of B, we will look into A. What do I mean by A, B, C, D, E? So as you can see, A is you need to assess your health. And how do you do that? We'll give you some tools to do that. And A could be for somebody who needs to take some medicine, such as aspirin. So that is an assessment. The B is for your blood pressure. And C is for your cholesterol, for cigarette smoking, C. D is for your diet and for diabetes as well. And E is for exercise. So if we address this all A, B, C, D, E, you are in a good position to know about your health, particularly with the heart, with the brain, and with most of the chronic conditions, we call them, that they are troublesome and that we know about currently with the COVID pandemic. And if you have these risk factors and conditions related to these medical problems, you will be in the worst situation if you catch the virus, in terms of going into hospital, surviving intensive care, and death as well. So it's really important that we go through this so that you know your body, you know your health conditions, so that you can manage them better and get the support that you need. So today, as I said, part 1, we will be doing the B part of it. So the B means the blood pressure. So when we talk about blood pressure, I would like you to know that we call it a silent killer. What we mean by a silent killer, as you would know later on, it is really doesn't give you anything. And if you don't know that it's a silent killer, and then you'll be in trouble. So we want you to know it and prevent it. So the key message from the blood pressure point of view is, so we would like you to know that this is a silent killer. So high blood pressure is a silent killer. And we would like you to know about it, so you measure your blood pressure yourself or a healthcare professional. We would like you to control your blood pressure so that to live better. What I mean by better, we will see it later on. And at the end, we would like you to know about, you need to start checking about the age of your heart. So everybody has his own age. That is the anagraphic age that we use from your date of birth. You can say I'm 30, 40, 50, but you can know, or you can estimate the age of your heart as well. And the NHS has given us some tools how to do that. So we will go through it hopefully by the end of this session. So when we say it's a silent killer, this is what happens. So it doesn't give you any symptoms, any specific symptoms. This is to do with high blood pressure, the hypertension, we call it in medical terminology. High blood pressure or hypertension has no specific symptoms. So it just kills the patient silently. What do I mean by killing patients silently? You can be blind because of high blood pressure that you didn't know for many, many years. You could have a heart attack or you didn't know anything about high blood pressure. The heart attack could be related to the high blood pressure. You can have a stroke because of the high blood pressure. You can damage your kidneys because of your high blood pressure. You can have heart failure because of the high blood pressure. It's basically demolishing your body because of the high blood pressure, which you don't really know about, or you didn't have any symptoms about it. When I say about stroke, because I am a stroke physician, I work with patients who had a stroke, and this is what I see. When I see a patient coming with weakness to the right side, to the left side, we do a scan of the brain, we look at the brain to see, is it a bleed? Is it to do with lack of blood supply? And when we see this white area in the middle of the gray area, this is bad news. This means there's a bleed in there, is pressuring the brain, and that person is in trouble. And this is the typical type of bleed in the brain that you get because of a high blood pressure. You can have it in different parts of the brain. These are the sites that you can see that you don't need to worry about. But what I want you to focus really is, if you don't control your blood pressure, you will end up having a bleed in the brain. And this means either you die imminently or you have troubles with moving your parts of the body. You can't talk, you can't swallow, you can't really do anything about it. You'll be dependent on others. I don't mean to scare you, but this is what really is happening when we see patients after stroke, and particularly young patients. They don't check their blood pressure, they don't know about it, or they know about it, they ignore it, they don't take their medications, they end up coming to hospital with a stroke. When you ask them, what have you done? I was just ignoring my hypertension and I wasn't taking my medications, and they regret what they were doing. We don't want that to happen to you. So you really need to think of what you can do for yourself by simple things. So I've showed you that it's not only bleed, you can have as well the lack of blood supply. We call it ischemic stroke in medical terminology. What it really means is, if you see this scan of the brain, both sides should be of a similar type of texture. You can see this darker area, and that's basically a dead brain because of a stroke. And that person, if they're right-handed, they can't talk and they can't do much on the right side of their body, or sorry, on the left side of their body. This means really hypertension or high blood pressure is really important that we monitor it, and this is the next thing. So when do we say that hypertension or high blood pressure is high blood pressure? It's basically, it's a number that we use, and scientists had a look at the various numbers. At which stage do we say this is high blood pressure? Is something conventional where they see, for example, here, if it is above 140 millimeters of mercury, that will be considered as hypertension. There are risks associated with that. The higher the number, the worse the outcome is. But in simple terms, what we really need to know is, and you need to know, is that the two numbers, the top one, we call it systolic, and the bottom one, we call it diastolic. When we measure these two numbers, we associate with them by a measuring sign. We call it millimeter of mercury. It really means just a measurement unit. So, but for you to know is, you need to know in numbers what your blood pressure is, the top and the bottom one. And the good thing is that people are working on this, and we have every year a World Hypertension Day. It's a day where we look at what we can do, how we can motivate patients and the population and the whole wide world. So the key message that last year was really to measure it, to control it, and to live better. I'm sure I've showed you, if you control your blood pressure, you wouldn't have the bleed that I've showed you. You wouldn't have a stroke that you had. You will be less. You wouldn't have any problems with disability secondary to stroke. Similarly with heart attack and heart failure, blindness, kidney failure, and the rest of them. So if you want to live better even longer, you really need to measure your blood pressure. Why do we say we need to measure your blood pressure? Because people in the UK and in the world, they don't really know whether they have blood pressure or not, because they don't measure it. In fact, every 10 people with high blood pressure, they really don't know if they had or not. 4 of them out of 10. 2 of them, they know they have high blood pressure, but still it's not yet well controlled. Only 4 out of 10, they know they have high blood pressure and it's controlled. So the good news is that it's easily measurable, it's preventable, you can control it, you can avoid all the potential risks that I've said to you about the organs that have been affected, the parts of the body that gets affected with high blood pressure. I've showed you here some machines that can help to monitor your blood pressure. It doesn't mean that you need to use this Omron. I have no conflict of interest, but I'm just showing you that you can easily measure it with some instrument that you can buy in supermarkets. You can ask your pharmacist to show you how to do it. You can ask your GP how to do it. You can ask any healthcare professional how to do it. You can do it. You can measure your blood pressure. Unless you measure your blood pressure, you wouldn't know what your blood pressure is. So coming back to the key message, hypertension or high blood pressure is a silent killer. We really need to measure your blood pressure. You can control your blood pressure. If you control it, you live healthy and you live longer. And I'm going to show you next how you check the age of your heart. To do that, that means you're going into the assessment, the A part of our simple approach. So A, we said you need to assess yourself. So this is a good website. We can send the link to you, to our community, on how to log into this website. You just need to copy and paste it, and this will take you into somewhere where you can actually put figures, and you can check whether what's the age of your heart and how you can get it better. So I'm going to give an example, a very simple example. Two ladies, A and B, both of them, they're 50 years of age. They're both from African Americans. They never smoked, both of them. However, one of them, they have high blood pressure, 170 over 100 millimeters of mercury. But the other one had a normal blood pressure, 130 over 80. They have the same height and weight. They have no other medical problems. They don't really know their cholesterol because they haven't checked their cholesterol. So if I put these parameters, these information into a system in the NHS, where you can look at the age of your heart, it gives me the age of the heart of this Mrs. A is actually 60. It's not 50. She's obviously, her age is 50, but the age of the heart is 60. So if I control the blood pressure, you get reduce of the heart, the age of the heart, by 3 years. It's just by controlling the blood pressure. It really tells you that if you control your blood pressure, you can do better with your health, and health means it affects every part of your body. So I hope I've showed you that with the A, B, C, D, E, we've done the B part of the blood pressure control about your health in general, and you can do some assessment. I'm going to go briefly to see how I can do the assessments so that you can see, maybe if you have time, if you're interested, you can do it yourself as well. So let me just copy this and paste it for you so that we see if we can do it now. A quick example, and that will be the end of the session. Just bear with me a second. What I'll do is I'll open another window and show it to you, and let me know if I can share it again. I'll stop sharing this and I'll go quickly to the heart age. Can you still see me, yeah? Dr. Khalid or Abu Yasir, you okay? Can you see me, yeah?
We can see you, but not the sharing slide.
Let me see if I can share it again. Okay, I think it's not easy. Let me just have a quick go on a different page and then I'll show it to you. Okay, and share this one. Can you see this one, yeah?
No.
Yeah? No?
No, we can't see any. Now it's coming.
Now it's
Yeah,
coming.
we can see that. Google.
Now, what I've done is I've just Googled heart age. It comes up with the NHS website, and I click on this one, and you can see that it gives you how healthy is your heart. So if you want to just click on that, so let's put this lady, she's born on the 1st of January 1970, which is 50 years old. She is female. She is from Black African. and her postcode is in Quba B74NE, and she doesn't have any heart disease. She never smoked. Her weight is, let's say, her height is 170, and her weight is, let's say, 60 kilograms. She has no diabetes. She has no arthritis. She had no kidney disease, no irregular heartbeat. We call it atrial fibrillation. She had no family who had any heart disease. She doesn't know her cholesterol. She's never checked her cholesterol. She knows her blood pressure, which is very high, 170 millimeter of mercury, and she doesn't take any treatment for that, or she doesn't want to take any treatment, or she doesn't know about it. So I'm just now generating the result of the age of a heart. This is all from the NHS website. If you just need to type heart of date, as I said to you, your heart age is about 60. Her age was 50, but the age of the heart is 60. So it gives me what could be the reason why this lady had higher age heart. It could be to do with cholesterol. So what they say is, okay, lower your cholesterol. I haven't checked it, but it gives me some indication. Okay, let me check the cholesterol. I monitored it and I lowered it, so the age of the heart gets better. I reduced my blood pressure. I measure it. It's controlled now. The age gets better. So really, it basically means if you control everything, and if I just do control the blood pressure only, her age improves. The age of the heart gets improved. It's better. It really means is once you control the blood pressure, high blood pressure, you are protecting your heart. You are protecting yourself. So the message is clear. High blood pressure. A is assessment. What we've done now is an assessment, which is assessment of your risk. And we've done the B part of it as well. So as we go along, we are going to be sharing the C, D, and E. And in the meantime, every time we do one part of the ABCD approach, we'll do the assessment. By the end of the session, every one of us listening, following us, they will be able to put their risk factors, all the blood pressure, the cholesterol, and the rest of it. They would know about their health better. They will be in a better shape to learn and do contribute their part to protect their heart, their brain, and their well-being in general. Thank you very much for listening. I'll next give a chance to my colleague, Dr. Khalid, to introduce himself and to give us some enlightenment, inshallah.
Jazakallah. I send you an email. Can you share one of my slides? It's just only one slide. While I introduce myself, you can share it. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everyone. Thank you for the invitation. I'm very happy to talk to you today. I'm here mainly to ask any questions that you have regarding COVID-19, but I'm also here to give you a very brief information how we can protect ourselves from infection of the virus, and how we can protect ourselves from not having the critical or the severe disease of COVID-19. So as you all know, the best way to defeat your enemy is to know the enemy. So without knowing the enemy, you won't be able to defeat the enemy or to protect yourself from the enemy. So in this case, it's the coronavirus. So it all starts with infection. Just to say a few words about me first, I am assistant professor at London School of Hygiene and Tropical Medicine in London, and I specialize in infectious diseases, mainly malaria, and this time doing some work in COVID-19 as well. So the coronavirus it starts with infection. So it's important to know how the virus infects human beings. So how does it affect us? And then if we're infected, some people get mild symptoms and others don't. Of those people who get mild symptoms, some people get severe symptoms, and a tiny minority of the people who become severely ill become hospitalized, and some of them sadly they die. So this is uh, the cycle, or the information about COVID-19. Once you're infected, there are different groups, and eventually some people die. So if you look at the infection, in terms of the virus, I think most of you know how the virus gets inside our body, and what are the risk factors. Where can we get infected with the virus? I think there are different ways of getting infected, but uh, the majority, or the predominant way of getting is during the indoor meeting, when you meet people inside a building. That's uh, the worst uh, setting that you can get infected with the virus, particularly in household, at home, when you meet with friends and relatives. It could also be in other settings like schools and mosque or anything, but the household, because of the contact period is very long. And that takes us to the second risk factor, which is a prolonged close contact. When you are in contact with someone who is already infected for a long period of time, then you have a very high risk of getting infected with the virus. So if we know how the virus infects us, what are the risks in which situations, then to control and prevent infection would be not challenging. For example, you avoid indoor meeting. Meet people outside, don't meet them inside. And then if you have to meet people inside for different reasons, either to visit a sick patient, or you have a Aza, or any other events that you cannot avoid, minimize the number of people inside the house, and also ventilate the room properly and adequately, so that the chances of the virus staying in the air infecting people will be lower. And obviously minimize contact time, whether it's outside or inside. When you speak to people, minimize the contact time. The more you speak to people who are infected and you're close to them, the higher the risk of you getting the virus. And as you all know, also stay 2 meters away, because we know that the virus, if somebody is infected, speaks even louder. There's a chance that the droplets that come out of their mouths, or when they sneeze, they can the droplets can travel up to 2 meters and they can infect you. Obviously, face covering, as you all know, and the other way to protect yourself. You cannot protect yourself from infection, but to protect other people is vaccination. So the other one is the mild symptoms. So some people, unfortunately, once they are infected, they develop mild symptoms. Others, they become asymptomatic, which means they don't show any symptoms. And these all depend on a number of risk factors. Age, for example, if you're older, you're more likely to develop symptom. If you're male, if you're overweight, as Dr. Al Khair were explaining about obesity, for example, and if you have weaker immune system for different reasons, either through age or due to immunocompromised situation in your body, and other reasons. And to control this, Dr. Al Khair already mentioned it, to do exercise, to lose weight, and then that would be one of the things. At least you need to go outside twice a day, and you could do running, jogging, a different type of exercise. And you can also watch your diet. Dr. Al mentioned that the blood pressure, cholesterol, if you don't eat balanced diet, then you develop different kinds of underlying diseases that are risk factors for severe symptoms of COVID-19. I think the third one is also you have to seek medical help promptly whenever you see any kind of symptoms. Don't delay it. If you have a mild symptom, do not delay. If you delay, then probably it could deteriorate without you realizing. So any symptoms that you see about coronavirus, COVID-19, it could be cough, fever, loss of smell, anything. Do not delay. Immediately notify the authorities, and you get information, support, etc. And obviously, the fourth one, vaccine. And then the other group of people who develop severe symptoms, most of them have got risk factors, again mentioned by Dr. Al-Khair. These are obesity, cancer, cardiovascular diseases, hypertension, high blood pressure. If you're above 70 and male, you have a very high risk of developing severe symptoms of coronavirus. So this is a lot of study made to see what kind of people are getting severe symptoms, and these are some of the people with underlying conditions such as mentioned above. And again, similar, the control is you need to do exercise to lose weight, balanced diet to have a healthy body, vaccines in order to prevent severe symptoms. We know that the currently available vaccines are quite good, efficacious to prevent severe disease of coronavirus. And then early reporting, I mentioned earlier. So if you got any problem, not only with the COVID-19, but also with the risk factors such as obesity, cardiovascular hypertension, all these ones. If you do a regular checkup and report early whatever you have, you can be a healthy person and then prevent COVID-19 from deteriorating into a severe symptom. And then the final one is a vaccine, as I mentioned. Of these individuals or patients severely ill, some of them cannot be treated at home, so they are admitted in hospital. Again, the risk factors are similar to the severe symptoms. The above 70s, male, people with obesity, cancer, cardiovascular disease, hypertension, and generally male are at high risk of admitting to hospital. And the control measure is similar to mild and severe symptoms, doing lots of exercise, balanced diet. But when you go to hospital as well, there is some sort of treatment, not 100% effective treatment, but they can give you some treatment, and if you're lucky, you can be treated as well. And then the vaccines obviously if they prevent you from severe symptoms, then they prevent you from going to hospital. Sadly, some people die. Again, if you end up being in mechanical ventilation in ICU, then you're more likely to die, unfortunately. So it's always better to know you are at risk of severe symptom or critical before that, so that you get enough medical help before you are admitted to hospital or using a mechanical ventilation. And if you're male above 70, you're very at high risk of dying of COVID-19. And also, if you have underlying health conditions that we mentioned above, the obesity, cancer, and etc., you're more likely to die from COVID-19. The control measure is similar. Not when you're sick, definitely, but before you become sick, if you do a lot of exercise, lose weight, you have a balanced diet, you look after your nutrition, your vitamins, regular checkup, your GP, that all will help you not to develop severe disease and death. But there are some treatments which not 100% cure you, but a certain percentage of people can be cured with those treatments, and vaccine can prevent severe symptoms, prevent hospital admission, that will hopefully prevent death. So this is a general information most of you know, but I think we need to focus on increasing our knowledge about COVID-19, from infection, how it infects us, up to when we get symptoms and how to deal with it, what information we need, where to go to get that information will be critical. I'll be happy to answer any questions you have with Dr. Al-Khair. Thank you for listening.
Thank you very much, Jazakumullah khair, Dr. Al Khair and Dr. Khalid. And it's really very beneficial. And I'm sure that most of the people who's listening and watching, they are benefiting from what you said, inshallah. I've got one question here. He said 4 years ago I heard that 120, 180 is all blood pressure measurement, which has been updated with 180. So the higher is 100 and the lower is 80, according to the American Heart. Yeah, according to the Heart American Association. What do I need to do when I take my blood pressure? So I think he's getting confused. Is that right? Yeah, I think he's asking which one shall I take, the old one or the new one? Dr. Awal Khair, we can hear you.
Yes, you can hear me now, yes?
Yes.
It was a very good question. I think the question, if I understood, was the numbers. So what number is a normal blood pressure? So every country, they have got their own specialists, and they look after they have guidelines they produce as well. In the UK, we have the NICE, we call it. So these numbers could mean differently to different age group. So children, they have different blood pressure measurement than adults. When you're an adult, if you have any health condition, for example, a stroke, after a stroke, we have a specific target for your blood pressure. And if you had a heart attack, or if you are older, more than 85, for example, you have a different target of blood pressure. In general, your blood pressure should be controlled. So if you're an adult and you are known to have high blood pressure, you're taking medications, the target that we aim here in the UK is 140 over 90. So the top 140, the bottom one 90. But you need to always check with your GP, your doctor, to see what's the range that is target for you. So that's the target. It can vary from day to night, or one day then the next day, but hopefully the GP or your doctor will follow you up regularly, and he will make sure that your blood pressure is under control. When you take medications, you may not feel anything. It's mainly the number that you see. So that's what we wanted, because it doesn't give you any symptoms unless it's so high with some complications. I hope the question has been answered. If it's not clear, they can ask again.
It's clear, mashallah. It's clear. Yes. What about the vaccine? Nowadays, I'm sure that you're receiving WhatsApp, email, Facebook, everywhere. This social media. We are only receiving the negative about the vaccine. So can you just tell us that what is the truth? Because people, they get scared, of having the vaccine. As I said, because most of the message we're receiving is negative. So can you just tell us a little bit, how can you advise people that to take the vaccine?
Well done, Dr. Khalid.
Yes, unfortunately, they say bad news travels very fast. So when you receive a message in WhatsApp, if it's about good things and how to prevent coronavirus, not a lot of people forward it. But if someone with no background, with no profile, speaks sensational things negative about COVID-19, then it travels fast. So as a community, minority community generally, I think we need to fight disinformation so that we protect ourselves, our family, and friends. And like I said in my introduction, the only way to protect yourself and your family is by getting knowledge. And the way to get knowledge is from authorities, health authorities, people with knowledge, people with credentials, people um, who are professionals. You can check them, whether it's in the internet, whether it's through their institutions. These are the only individuals that we have to listen. If anyone send a message, a video, or anything claiming about any information about vaccine or coronavirus, the first thing we need to do is check the background of that person. Does the person exist? If it doesn't exist, then we don't have to forward it because we are misinforming our friends and family. So, in terms of the efficacy of the vaccine, the report for majority of vaccine were very effective and safe to use, and millions of people are vaccinated in the world now, more than 40 million. And in terms of the effectiveness, we're going to find out more, but they are still effective. And in terms of safety, very few people are adversely affected, which means with a serious effect because of the coronavirus. So any information that because of the vaccine. So any information that we get about vaccine, it doesn't mean if you have any doubts about the vaccine, it doesn't mean you don't ask. You have the right to ask. But maybe you could be a type of person you shouldn't get the vaccine because of could be allergy, or it could be many factors. There are individuals that they are not recommended to take. So you have every right to ask. But whenever message you get from people unfounded information, I think we need to be very careful not to spread that information.
Okay, Dr. Awakir, would you like to add some?
Yes, I think it's a big topic. We actually had a section or a session, myself and Dr. Khalid, and Dr. Kamal, Dr. Ahmed, few colleagues. We do information awareness on COVID-related topics, and we have an organization called Eritrea Health, where we posted on YouTube channels on these topics. I would invite everyone to have a look at and go through them. Hopefully, you will find them informative. Just to add to what my colleague Dr. Khalid said, the misinformation itself, it gives you the so-called vaccine hesitancy. So it's one of the reasons for vaccine hesitancy. What do we mean by vaccine hesitancy? People, like in the UK, for example, you have access to the vaccine, but you're reluctant to take the vaccine because of this misinformation. And however, in somewhere else in Africa, they may not have access to it. There's another problem as well. So there's a specific team looking into that in the WHO to make it equally available. So access is another problem. But vaccine hesitancy, according to the WHO, World Health Organization, is one of the 10 reasons or the biggest problems that are globally concerning. There are 10 things that the WHO is worried about. One of them is vaccine hesitancy, which means people, they have access to vaccine, but they're reluctant to because of somebody has told them, oh, my friend didn't want it, didn't like it, or he heard of bad things, so I'm not going to take it. This is not good, because if I am taking it as a healthcare professional, I have taken the vaccine myself, a Pfizer vaccine. If somebody else, Joe Biden has taken it, all the relevant, the big people are taking it. Why are you not taking it? And this is created by lots of efforts. They've invested loss of money on that. And we need to respect what the healthcare professionals are saying, particularly those specialists who are working there. Actually, that's their job, to make sure that it's safe for all of us. So I can reassure you, vaccines, everywhere you go, follow the authorities who are responsible. If they say it's safe, then it is safe. And if you have the opportunity to take it. And if you find any misinformation, as Dr. Khalid was saying, ignore it. Thank you very much.
Okay, one of the question is, why should I take it if I'm not, I'm strong enough and I feel that, I'm healthy? Why do I need to take it? This is maybe for the people who have some sickness or illness. Personally, I don't have no problem. I'm a healthy man. I don't feel no illness. So why should I take it? That's one of the question from a brother.
So I can give you a good example. Working in hospital and looking after COVID patients, we see young patients coming. You can tell me, okay, that young gentleman may have had problems, but I can tell you, with no medical problems, they were fit and healthy like you, with no medical problems. They end up in ITU, in intensive care, in ventilation. They even die from it. So really, it's not just to do with being young. There are many things that we're still learning. So even if you're young, you can have the virus, you can have severe infection leading to hospital admission, intensive care admission, and even dying. If not dying, you can have a debilitating complication after the infection as well. So unfortunately, it's not available for everybody. If it was available for everybody, including young adults, then I wouldn't really be reluctant to take it. I would take it as well. So really, the message is clear. It is a body infection. It can affect anybody. And the vaccine, if you're able to take it, do take it. Dr. Khalid, تفضل. You want to add?
Yeah, just want to add some information. I think Dr. Al Khair in his talk, he mentioned that high blood pressure is a silent killer. In other words, a young person probably might be unaware of his health conditions. You might have high blood pressure, or you may have other underlying diseases that you're not aware of. So it's not guaranteed that when you're infected with coronavirus, you will not develop a severe disease or something. That's one argument you can use. And the other is also, we've seen the virus is changing. We've heard the report from the government last week saying that the new variant kills more people compared to the old one. So if the virus changes and become, for example, virulent against all individuals, including young people, then you probably would be in a big trouble as well. In the end, also, it's all about thinking about the community rather than only individual yourself. So if everyone takes coronavirus, everyone is protected. If everyone takes a vaccine, everyone is protected. So it's not only about individuals, also about community and society. Thank you.
Thank you very much. Really was very beneficial, and I would like to thank Dr. Al Khair and Dr. Khalid for being with us today here, and it is our pleasure. Thank you very much. And I would like to say to those people who are watching us, inshallah, Dr. Al Khair and Dr. Khalid, they are willing to be with us, inshallah. Quba Islamic Center, Quba Medical, that is going to be arranged with them, inshallah. So we'll see you, inshallah, from time to time until we give the timetable, inshallah. We'll let you know. And the second thing, we would like to announce that tomorrow, inshallah, we're having Dr. Tariq here as well at the same time. Is a philosophy. He's going to talk about the psychology. How is the coronavirus and the lockdown is affecting people mentally and and physically. So inshallah, be with us tomorrow at the same time. Jazakumullah khair. Thank you, Dr. Khalid, and I would like to thank Dr. Awal Khair as well.
Thank you.
Thank you.
Thank you.
Thank you very much.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.